Interverrà ora il professor medico Thomas Dorn, primario di neurologia alla clinica di riabilitazione Sonmat di Lucerna. Und zwar Herr Thomas Dorn, Chefarzt der Neurologie an der Riabilitationsklinik Sonmat in Lucerna, con il tema perché i testi genetici sono importanti nei casi di disturbi dello sviluppo intellettivo e epilessia. Und zwar, warum ist genetische Diagnostik bei intellektueller Entwicklungsstörung und Epilepsie wichtig? Herr Dr. Thomas Dorn.
Thank you very much. I will give my talk in English. So I can. I will give my talk in English because I think I can reach most of you in English and not in German because I'm not able to speak Italian, unfortunately. First of all, I want to thank you as organizers for this invitation. It honors me, and the second aspect is, and this.
Prova, missionaire, prova.
Okay, oui. Yeah, and the second positive aspect of your invitation is that I could go by train here to Locarno. I come from the Valleys, and then I could have the opportunity to use the Cento Valley train, and it was very impressive. Also, I know this region here for many years, but it was a new experience. So, yes. Why is genetic diagnostic, or why are genetic diagnostic procedures important in people with intellectual disability and often also epilepsy? I'm a little bit afraid that I can tell you not so much new because I have heard the presentation in the late morning, and I was very impressed that you have touched all the very important issues of modern neurogenetic science concerning this disease, concerning SLC6A1. But what I can tell you is that you are not alone, because these issues are important for many neurodevelopmental and neurogenetic diseases, and I want to give you a little bit an impression of this large field, which is in which you with this special disease are a very good example to develop the things further. So, and I have also I must also say that I am not here as the head of the neurological department of the Reha Clinic Sonmat in the first line. I am here also as a board member of the Swiss Society of Health and Intellectual Disability. This society exists since 2018 and consists of people, or health professionals, which are engaged in the care of people with intellectual disability. There was a former organization, it was only for doctors. It was founded in 2007 at the Swiss Epilepsy Center, where I worked many years before. And this society was called the Schweizerische Arbeitsgemeinschaft für Menschen mit geistiger und Mehrfachbehinderung. We try to improve the medical care for people with intellectual disability. And so I'm today here as a board member of this society. Yes, I want to show you that your needs are well known, but your needs for adequate treatment of your of the patients with SLC6A1, your needs are known and for a long time. And you have also on your homepage, I have seen you have mentioned the relevance of genetic diagnostic procedures to make an exact diagnosis, because this exact diagnosis has many implications and can improve the life of the patients. And this is very important, and I want to show you that there are other examples in which these issues are important. And this is my talk, and at the end I will give you some summary, but also some view in the future. But I can say it now already, there is much work to do to improve the things in Switzerland. Also, Switzerland is a very rich country, but we are unfortunately, I think, behind the Scandinavian countries, for example Finland, and also other countries. Yes, the Swiss Academy of Medical Science is an organization which have at first in 2008, it's almost 20 years ago, they have published guidelines for the treatment of people with disabilities. And they have said that it's very important to have an etiological diagnostic procedures to find out what is the reason for this disability. And they claim that each patient with this disability has a right to have an exact diagnosis. It was in 2008 already. And they also gave reasons for these exact diagnostic procedures. And they say that it is important, on one hand, on one side, for the families, it may be very important to know what is the reason for the disability, because it's also in my experience that in many families there exists some fantasies, some myths which are not true, but which prevent a better treatment, because they say, yeah, the mother is guilty, the father is guilty, and all these terrible things, or there was an accident, or the doctors have not done the right during the birth, and all these things, because it's very important. But they also claim at that time that an exact diagnosis is relevant for better treatment, for the prevention of complications, because if you know exactly a syndrome, then you know, it could happen this and it could happen that. For example, trisomy 21 is a very good example, because we know that if someone has trisomy 21, he could have other diseases. We have, for example, look closely on the blood, because there is a possibility of leukemia, which is a higher probability. We have to look on the thyroid gland and other things. So if we know an exact diagnosis, we are able to prevent complications. But what becomes more and more important is, yes, we can have therapies which are directed to these genetic disorders and can change the course of the disease. And this was already claimed in 2008. And now we have 2026 and we know a lot more. But unfortunately, this is not really understood. Also, these guidelines should be part of the Berufsordnung from the doctors, from the Federatio Medicina Helvetica. Yeah? But I think it is not really read and not really understood. Looking at the cause, or trying to find out the cause of a disability, means you have to do genetic diagnostic procedures. And at the time when the Swiss Academy of Medical Sciences published these guidelines, we were in the situation that we have to find a word false, written in a false manner in a big encyclopedia. And I have here an encyclopedia with 26 volumes. So we can say we have in the human genome, we have 46 chromosomes, and we have to find one false written word on one of these chromosomes. And you can imagine this was not very easy, and at that time when these guidelines were published, we were only able to find this false word when we nearly know where we have to look in this encyclopedia. Let's say on which page or in which volume. Meanwhile, we are able, with the modern technologies, we are able to screen whole these volumes, whole these chromosomes, for a false written word. But the problem is, not each word which is not written exactly is also not understood. This means we are able to understand a word in a context, even if it is not written in the right manner. And this is also the case with our genes. Our genes could be not normal, but they could not cause, this abnormal gene must not cause a disease because it is not relevant. This is there's one letter wrong, which is not relevant for the understanding of the whole gene of the whole word. This is our problem now. We can screen, but we have difficulties in the interpretation of the results with these new technologies. And which are these new technologies which have emerged in the since 2005, let's say 2006, and then especially in the decade between 2010 and 2020, we are able to read out the whole genome. Yeah? Base pair by base pair, we are able to. This is modern technologies which are driven by the developments of for computer technology. This was a very important prerequisite to have this new diagnostic tools. We need the big data. Yeah? It needs the management of big data, and this was possible. This is one method, and we can now screen the whole genome. This means the genes and also the DNA which is between these genes, and also the DNA which is in the genes but is not relevant for the synthesis of the protein. We are also able, and this is routinely used, the whole exome sequencing. And at the beginning of these new technologies, we have used the panel. The panel means that we, for example, an epilepsy panel consisted of, let's say, 100 genes, which are candidate or good candidates for epilepsy, but it does not cover all possible genes. But now we are able, let's say for 2,000 francs or 2,000 euros, screen the whole genome. But if we screen the whole genome, we have a lot of interpretation problems because we see a lot of words written wrong, but whether this has a meaning is not so clear. The other method which emerged during the last 20 years was this copy number variations. The problem is that you not only have letters which are not correct, it is also possible in your genome that you have maybe a whole sentence of in such a encyclopedia is missing, and or it's duplicated. You have this sentence 2 times or 3 times or also 4 times. It's also possible. And this can also cause diseases. And therefore you need another methods to find out this, but now there are new methods with which you can solve two search scenarios with one method. These are new developments. You do not need to have this 2-1. I have explained you have only one. But this is in development. I have said, looking at the reason for intellectual disability or intellectual disability in combination with epilepsy means genetic diagnostic. Why is it so? What is the proof of this hypothesis? This one proof of this hypothesis is this work done by Professor Lemke in Leipzig. He was an assistant of me in the Swiss Epilepsy Center and was very engaged in the genetics of, or is still engaged in the genetics of intellectual disability. And he has done some years ago a study with 150 patients with epilepsy and intellectual disability. And the astonishing result was that he could, with these methods I have mentioned, with whole exome screening and also this copy number variation tools, he was able to find out the exact diagnosis in 47.3%. And this is not, I think it is not the truth, it's an underestimation of the truth. In truth we have much more, but our capabilities to detect all these pathogenic variants are limited. And at that time he used only whole exome sequencing and not whole genome sequencing. So it is really an underestimation. But what was also interesting, in patients which were known to have complications during birth, the amount of a genetic cause was even higher than in the whole population. And this also, and the third issue was that MRI does not is not very useful to establish the exact diagnosis. And now, when you look from the economical point of view, when you have a child or an adult person with an intellectual disability, and you do an MRI, you have to do it in narcose. And this is much more expensive than a genetic test. Yeah, but this is not clear to the health insurances and to persons which are responsible for some regulations. Now I want to give you some examples how or why genetic diagnostic procedures are helpful. I begin with a more simple issue. This example should show that it is very important to have a genetic diagnostic, or have a result in a genetic testing, not because you have better therapy, but only for the family to have a clear concept what is the reason for the disability in the family member or the family members, and also for genetic counseling. These two young people are the brother and the sister, and you see the man, he has this helmet. He has this. Kann ich hier irgendwo auch leuchten? Ja? Ach so, so rum, ja. Moment, hier, ja, okay. Ja, genau. Here you see this point, he has a helmet and he has an epilepsy with atonic seizures, with falls, and though he has during the day, and so he has this helmet. His sister did not need a helmet because he has her seizures only during night. But it was a pharmacoresistant situation, and you could say that it was a Lennox-Gastaut syndrome. It's an electroclinical term which describes a combination of several seizure types, and one seizure type are these epileptic spasms. And they both have them, but she only during the night and he during the day. And now, these are the two, from her we had a CT only, and from him we had an MRI also at that time. And here the imaging shows some very important issue. You can see here that the cortex of the brain is not normal, because this polymicrogyria, this means that this is has much more foldings than the normal brain, and this is usually or is a reason for intellectual disability and also for this epilepsy. So when he was in my care, and someday the brother come with her, and the brother wants to know what is the reason why. He has a wife, and they want to become children, and he wants to know whether there is a certain risk. It comes out that they come both from Turkey, that they belong to a large Turkey family, and here is the lady and here is the boy, and this large Turkey family has some amount of consanguinity, what is not what is often could be often the case. And so it was, and so it was clear that the possibility, if this was a brother who asked me what is the reason, because he had a wife also which belonged to this family system. He has some he has some idea that there could be a genetic cause, but in the family at that time it was not accepted that it is for genetic. But the brother was able to convince the family to participate on blood sampling, and at that time he had this new method. It was in the beginning of it was in 2005. We had to ask someone, and I know at that time Professor Guarini from Pisa, and Professor Guarini said he had big experience with such brain malformations. He said, yeah, I have an idea where I have to look in this encyclopedia. And then he made blood tests from her, and also from the brother, and also from the parents, which lived in Ankara at that time, but they came to Switzerland and gave blood for this. And it turns out, finally, that there was a mutation in a gene which is called GPR receptor 56 gene. Yeah? And there was a pathogenic variant, and it was homozygous in the both. And the good news was for the brother, he had no pathogenic variant, so it was not important for him whether his wife would have the gene or not. So they could have children, and he was very glad that we could solve this problem and could diminish his fears. Yeah? But this reason for a genetic testing is not really accepted by health insurances. Yeah? So now I want to come to the point why genetic testing is important for determining the therapy in people with intellectual disability. I think you know this. You have a gene, you have a DNA, you have a chromosome, and you have here on the DNA you have a gene which is not has a mistake, is not or cause problems on the level of the proteins. And if you have problems with proteins, then you have mostly also problems in the cell. The cell metabolism doesn't function really, and then you can also have problems in the whole brain, for example, or in another organ. So you have a pathogenic gene variant, for example in SLC6A1. You have also different pathogenic gene variants are known, and you have a disturbed protein function. It is this GABA transporter in the SCL6A1, and from then on you have also disturbed cell functions, and maybe also structural findings, structural alterations, and on the end you have also disturbed tissue, brain tissue. For example, you have epileptogenesis. You have a network which is responsible for the intellectual disability, for autism, or also for the movement disorder you can have. And then you have the whole organ, and it is possible, although I think it is not the case in SCL6A1, but in other genetic diseases you can have also problems with other organs, not only with the brain. And then all this together forms the illness. Is that what we as a doctor see when a patient comes to in our consultation? And this now, with all this knowledge, if you have a disease in which you have this knowledge and can describe this, you have opportunities to treat. If you only have the illness and do not know what is behind this illness, you can try to improve the symptoms. For example, epileptic seizures, as it is the case also in SCL6A1. You have to treat epileptic seizures, and then you do it as you do it in other patients with other diseases when they have epileptic seizures. You try different anti-epileptic or seizure suppressing drugs. So the other thing is, if you have no knowledge about the reason for the disease, you can do only this. You can only try to improve the symptoms. But if you know the pathogenic gene, and if you know which protein is affected, and if you know how cell function, tissue function, organ function is disturbed, you have much more possibilities to influence, to improve the illness. And this is the situation you have in SCL6A1, and we have also in other neurogenetic disorders. And why? And there are different levels for which it is important to have the exact diagnosis. It can begin with a choice of the anti-epileptic drug. I have mentioned before, if you have a patient with seizures, you try one drug after another. But it may be that you have a condition in which one drug is better than the other, or one drug may have adverse effects. This could be the case in so-called mitochondrial cytopathies that are also very rare diseases. And when you give valproic acid, depakine, then it causes a severe liver failure with death as a consequence. And there are some mitochondrial diseases they are very similar to so-called progressive myoclonic progressive myoclonus epilepsies. And one of these progressive myoclonus epilepsies is the Unfricht-Lundborg syndrome. This is the most common. When you know that someone has this, you should not give him phenytoin, for example, but you may also make bad experiences with other anti-epileptic drugs, carbamazepine, oxcarbazepine, tiagabine, vigabatrin, and so on. So it is important to know exactly which, what is the genetic cause of this. And then you will know maybe the Dravet syndrome. There's also a very active group in Switzerland, Dravet Swiss, which is very engaged in this syndrome. And here you have also problems with some kinds of anti-epileptic drugs. You should not use them, as for example also phenytoin, but also lamotrigine, for example. Lamotrigine can make the things worse. So, and then, and this is also the case in SCL6A1. I have written that, I have read that it is important to know not only there is a pathogenic variant in this gene, but it may also be important to exactly know which variant is responsible. And this is also the case in a syndrome which is connected to pathogenic variants in the SCN2-1 gene. It is also a gene for a sodium channel, as it is also in the Dravet syndrome. And here, the type of variant decides whether you can treat with carbamazepine or not. And so it is very important to know exactly the genetic diagnosis in a symptomatic treatment of epileptic seizures. But you do not want, but we have to look a little bit more, we have to open our mind, not only to epileptic seizures, but to the whole phenotype, especially the phenotype is progressive. If the phenotype is progressive, you want to stop the progression as early as possible. And there are indeed diseases in which you can do this since many years already. One is a very rare disease. It is the so-called inborn error of metabolism, the so-called GAMT deficiency syndrome. And if you detect this and you know that the patient has this, then you can give him a special diet, and you have to give him ornithine and arginine, diminished diet, and then it will improve. And this is not only the case in children, this is also the case in adult persons. In adult persons, this may also have an effect on the health of these people. The other example is the so-called glucose transporter defect. Glucose, you know, is very important for us. It's the energy, it gives us the energy and also the energy for the brain. And if the transport of glucose in the brain is not possible, then it is not very good for the brain. The brain will become, the cells will be, can die, the brain size diminishes, and also epileptic seizures may occur. And if you make an exact diagnosis, then you can prevent all this and can improve the condition of the patients significantly if you use so-called ketogenic diet. Ketogenic diet, I think you know it, is used also in other epilepsies which are difficult to treat or resistant to a lot of anti-epileptic drugs, but in this special condition it is the therapy of choice, because you can really influence, you can really diminish the progression and the symptomatology of this disease. And then we have diseases in which we can also influence or diminish the progression. And one example, which is known for more than 10 years, is the tuberous sclerosis. It is a multisystemic disease. It does not only affect the brain, but it does also affect the skin. And this is the most you can see, or you can make the diagnosis if you look at the skin of the patient. Most of them have in the face, they have these changes, and they have other changes here, so-called white spot, which you see in ultraviolet light, and there are some other things on the nails and so on. This is very typical, but it is not the only manifestation. You have also, of course, the brain, and in the brain you have two kinds of pathology, or two important kinds of pathology. One are these astrocytomas near the ventricles, and they can grow, and if they grow they can make disturbances of the circulation of the cerebrospinal fluid, which is not so good because it can be life dangerous. And the other thing you have in the cortex, you have such tubula, and they are responsible for the epilepsy these patients often have, and also this. But these are only the tip of the iceberg, because there are also microstructural changes in the cortex, and most of the people have severe intellectual disability and also autism. But they are also form of Rust with not so much symptoms. So, and the other thing is it can also affect other organs. For example, the brain can make renal problems and tumors in the brain, so-called angular lipomas, and it can also in women affect the lung with a very severe disease, which it can be also life limiting. And now the genes of this disease are known very long. I think it goes back to the 80s of the last century. They have discovered two genes, chromosome 9 and chromosome 16, TSC1, TSC2. But knowing the genes has driven further research, and now we know that these two genes and the gene products, their proteins, hamartin and tuberin, are responsible for cell growth. They regulate cell growth. This explains very well that we have such tumorous manifestations on the skin, in the brain, and in other organs. And this was the base for finding a therapy which could influence or could diminish the symptoms in many organs or on different places. And this was this rapamycin. Rapamycin was known from oncology and immunosuppressive therapies, and it inhibits this so-called mTOR, mammalian target of rapamycin. And when you do this, then this tendency of proliferation, of growth of tumor cells will be diminished. And then there was a drug which is derived from rapamycin, everolimus, and it could be shown in large studies that this drug could diminish these astrocytomas. Here's one example. You see it is big, then it becomes smaller, and here it is not so good visible any longer. And So you can prevent this complication. The other point is that it can also diminish the tumors in the renal, in the brain, and it also has an anti-epileptic effect. This is a combination, and it also may improve the cognitive and psychiatric situation in these patients. So it is very interesting, but the disadvantage is you have to give it lifelong, because if you stop it, the tumors will immediately begin to grow again. This is one example from me. It was given, Vutulia was given from the nephrologist because of renal tumors, but the side effect was that the seizure situation improves. This was a situation before with very often seizures, also with dropping and with traumata. And after the start of everolimus, the seizures nearly disappeared. And another side effect was that it improves also the skin changes which have been done. So, and now you have talked this morning about gene therapeutic possibilities, so I will not cover this field, but you have mentioned there's gene therapy and also antisense oligonucleotides are possible, and are also tried obviously in SDL6A1, so you are really on the edge of knowledge in this field, and of course it is only possible if you know the exact genetic diagnosis, otherwise it's not possible. And these are also examples with single patients with antisense oligonucleotide treatment or with gene replacement therapies, which are presented by Rebecca Schüle from Tübingen at the DGN Congress and German Society of Neurology on November 24. And so we have, when we have intellectual disability with or without epilepsy, we deal with a rare disease. Yeah? And rare disease is defined as disease rarer than 1 to 2,000. I have read 1 to 38,000 with SLCA1, so it's a very rare disease, and they are often genetic. And it's clear that the rare diseases, the genetically determined rare diseases often affect the brain. Why is it so? Because the brain is the most complicated organ. It uses a lot of our genome to come into growth and to develop. So it is clear that many rare diseases affect the brain. And so it is really important to have this exact diagnosis. But, and this is really the problem I see here in Switzerland, and I have not understood really why is it the case. We have this knowledge, we have these rules of the Swiss Academy of Medical Science. But in the Analyseliste, this is the list from the health insurances in which all the diagnostic procedures are listed, which are covered by the health insurance. We have the situation like 10 or 15 years ago. It confers to panel diagnostic. There is no whole exome sequencing, whole genome sequencing is not mentioned in this list. It's for me, I cannot explain it. And then you have to make a lot of efforts to get a diagnosis, to get the reimbursement from the health insurance. And the other point is, the knowledge is one thing, but it must be applied to the patient. And therefore you need specialized centers in which there are experts which are engaged in this, and you have also, you have several disciplines. You may have a neurologist, a psychiatrist, a general practitioner in such teams, but also other specialties and also non-medical specialists around such a patient to give the adequate cure to them. And for me, very disappointing is the fact that the movement around the rare diseases does not really have an interest in patients with intellectual disability. It's very difficult with Prolaris and on the lay side, and also very difficult with COSAC, the Koordinationsstelle for Rare Diseases in Switzerland. They are interested in neuromuscular diseases, in ocular diseases, but this is not covered very good. And this is very sad, and I think we have to try to improve it. Thank you.